Hello friends, Sarah here from the Centre for Mental Health. I hope all is well this week. Today we are going to talk about Equally Well UK. If you're one of our followers, you would have seen that yesterday we launched Equally Well. And Equally Well is a collaborative campaign that we have adopted from New Zealand. The New Zealand campaign was in fact launched by an ex-member of staff from the Centre for Mental Health, the fabulous Helen Lockett, who has done extraordinary work in New Zealand about bringing physical and mental health together. We want to do the same in the UK. It's still deeply shocking that if you have a serious mental illness, you're 3.7 times more likely to die before the age of 75, 15 to 20 years before everybody else. It's like the life expectancy in the 1950s. That's extraordinary, and it's not acceptable. There are many reasons for it, and some are because we are just a fragmented health system. Some are more sinister and worrying because it's around stigma and discrimination. We heard yesterday at the launch powerful testimony from two people with lived experience, Hannah and Nikita. They shared with us their experience of managing physical and mental health conditions. What they told us was shocking, sadly unsurprising. They told us that they would often have self-harm treated in a non-compassionate way at A&E, a story that I have certainly heard many times. We heard that people with mental illness are less likely to have their physical illnesses diagnosed quickly enough for positive management. If you have got diabetes and a mental health problem, you're more likely to struggle to manage your condition, or both your conditions, frankly. It is quite extraordinary, and one of the things that we think at the Centre for Mental Health is that this is just unacceptable. All health inequalities must come to an end. We have the resources to do that. We have the evidence and the knowledge to do that. There are some great things going on around the country. There are health checks being undertaken. There is liaison psychiatry in A&E. So the gap is closing. But the Academy for Royal Medical Colleges in 2016 said that what we really needed was a national coordinated effort. That's what Equally Well is all about. We want to bring together all of those people that have a stake in making a difference. So we want to hear from you if you're a mental health organisation, if you're providing physical health care, if you're a GP, if you are a pharmacy, if you have an interest in this space, please do get in touch. I feel really, really strongly about it. I have spent such a long time in mental health services, watching people with profound physical illness not getting the help that they need, their health deteriorating to a point of disability. We have it in our gift to make some significant changes. And when the collaborative members met yesterday, there was a heartfelt commitment and energy to making a difference. Wendy Byrne, the president of the Royal College of Psychiatry, immediately acted on what she heard about attitudes in A&E. It was really powerful. We had ideas about how could we make sure that people who are on acute inpatient wards were getting nutritious and, exercise that wasn't just about being allowed out of the ward so that you could smoke. All of these little things accumulating together could make a massive difference. We need to know from you what are the things that actually make both your mental health and physical health come together in a positive way. What do you need from your GP? What do you need from your psychiatric nurse? What do you need from the community to make it easier to stay healthy when you have a mental health condition? We want to know. We want to be able to scale up and share that knowledge around the country. We're following Equally Well New Zealand and now Equally Well Australia. We can make a difference. Let us know what works for you. Let us know also if you've had a difficult experience, because actually sharing those experiences too make dramatic differences to the way practitioners work. We need to talk truth to power, and certainly yesterday we challenged many assumptions about the way people are treated. When Nikita and Hannah gave their testimony, there were audible gasps in the audience. That story, those stories are important. And Equally Well UK is making sure that the experience of individuals is front and centre of everything that we do, every solution that we suggest. We are particularly keen to know what it's like for people from minority groups, older people, younger people. What is it like for you to get your healthcare or get the healthcare that you need? Equally Well is pushing the envelope. We are forcing agencies to examine what they do and how they do it. Join us. The more the merrier. I think the more voices that we have, the more organisations that we have, we will be able to close the mortality gap. If you're interested, email Emma Bailey at thecenterformentalhealth.org.uk and sign the charter.